Today, we're going to go through several simple eye health tests that you can safely do at home to get a general idea of how your eyes are doing. These are some of the same screening tools we use in the office, and while they don't replace a full eye exam, they can provide valuable insight into your vision. By the way, I'm Dr. Michael Kua. I'm a board-certified ophthalmologist with Prentice Hills Eye Care, and I create educational content to help you see better, look better, and feel better. Let's get started. The first test is called the astigmatic dial. If you normally wear glasses, go ahead and take them off for this test. Cover one eye at a time. Starting by covering your right eye, look directly at the center of the circle and keep your gaze fixed there. You'll notice several straight lines radiating outward, similar to the spokes of a wheel. Pay close attention to how the lines look. Do they all appear equally sharp and dark? Or do some lines look more faded, gray, or blurry than others? Notice which directions appear clearer to you. Now cover your left eye and repeat the process, again focusing only on the center of the circle. If you notice that certain lines look sharper while others appeared blurry or lighter, this may suggest astigmatism. Astigmatism occurs when the cornea, the clear front surface of the eye, is not perfectly round like a basketball, but instead has a slightly oval shape, similar to a football or egg. If the cornea is shaped more like an egg standing upright, this is called against the rule astigmatism. If it's shaped like an egg lying on its side, that's called with the rule astigmatism. People with the rule astigmatism tend to see vertical lines more clearly and horizontal lines more blurry, while those with against the rule astigmatism experience the opposite. This simple test can give you a clue, but an eye exam is needed for confirmation. The next test checks color vision and is known as the Ishihara color vision test. Again, cover one eye at a time, starting with your right eye. You'll see a series of images made up of colored dots. Each image may contain a number formed by dots of a slightly different color. Look at the first image and note the number you see. Move on to the next image and do the same, then the third, and finally the last image. Some places are designed so that people with normal color vision see a number, while others are meant to appear blank. When checking your results, the first image should show the number 74, the second should show 97, and the third should show 16. The final image should not contain any visible number. If you were unable to see one or more of the numbers, or if you saw a number where none should be present, this may indicate some degree of color vision deficiency. You can repeat this test using the other eye to compare results. If you suspect a problem, it's a good idea to have a professional evaluation. The next screening checks color contrast sensitivity. In this test, you're asked to identify which color looks different from the others. Some of these can be surprisingly difficult. Difficulty with color contrast may be associated with optic nerve problems in the clinic. Patients with optic nerve conditions sometimes report that colors appear faded or gray, especially reds. A classic example is optic neuritis, which can occur in people with multiple sclerosis. These patients may notice pain with eye movement, blurry vision in one eye, and reduced color intensity. When colors appear washed out or pink instead of red, it can be a sign of optic nerve inflammation, which always deserves medical attention. The next test evaluates your visual field, which refers to your peripheral or side vision. This test is commonly used to monitor conditions like glaucoma, where peripheral vision can gradually be lost without obvious symptoms. To perform this at home, cover one eye, starting with your right eye, and stare directly at the center of the screen. It's very important to keep your eye focused on the central target and not look around while maintaining central focus. Small lights or flashes will appear in different areas around your peripheral vision, depending on your screen size. You may need to sit closer so the test fills more of your visual field. Instead of pressing a button like you would in the office, simply count how many flashes you see. If you saw all 11 flashes, that's a good sign. You can repeat the test with your other eye for comparison. The final test is called the Amsler grid. and it's commonly used to screen for macular degeneration and other problems affecting central vision. Cover one eye and focus on the dot in the center of the grid. All the lines should appear straight, evenly spaced, and uninterrupted. You should not see blurry spots, missing areas, or dark patches, which are known as scotomas. Another concerning sign is if the lines appear wavy, distorted, or as though you're looking through water. This distortion, called metamorphopsia, can be a sign of retinal swelling or wet macular degeneration. After checking one eye, cover it and repeat the tests with the other eye. These home vision tests can be helpful and informative, but they do not replace a comprehensive eye exam. The tests performed in an eye doctor's office are far more accurate and can detect problems much earlier and more precisely. Still, these screenings are useful tools you can use at home to stay aware of your eye health. If you live in the Los Angeles, Orange County, or Inland Empire area and would like a complete eye exam, you're welcome to visit our website or call our office to schedule an appointment. Be sure to subscribe to the channel for more eye health tips. And if you're interested in learning how to reduce your risk of macular degeneration, check out our other educational videos.